So let's talk about biomarkers in their role in the diagnosis of cardiomyopathy in dogs. There's troponin I, and troponin I is considered to be a myocyte marker. So it is released in humans if you have a myocardial infarct. Since we have a cardiomyopathy in dogs with DCM, it is not surprising that it is in the advanced stage already elevated, also elevated in dogs. You can see here a study in boxers with ARVC, with arrhythmogenic right ventricular cardiomyopathy, and they had higher troponin I values compared to the control groups. Most of these dogs were in the advanced stage of the disease, but this study had proven that troponin I can be used for that. Would be also kind of interesting to use biomarkers as screening tests, especially in diseases that are hard to diagnose. And DCM in the occult phase is one of these diseases where a biomarker would be really valuable if it would work. We looked at troponin I in Doberman pinschers, and in that study, as you can see, we had several stages. And all stages were significantly higher compared to the control group. Interestingly, also dogs that only had ventricular premajor contractions had already, as a group, increased troponin I values. The dogs that had then the classical DCM type with a poor contractility had even higher values. Does that mean now that a troponin I measurement can replace, for example, the Holter examination or the echocardiography? The answer is no. But we think that this is a valuable additional test that we can use for early diagnosis. Because we had, for example, here one group which is called last normal. Last normal means we had dogs that came to the clinic, we did an echocardiography, we did a Holter examination, and that examination was normal. So, but these dogs developed DCM within 1.5 years. So we took the troponin I value of that last normal examination and looked at that as a group, and as you can see here, it was already elevated. So to summarize troponin I, what does it mean? We think it is a useful additional diagnostic test. Normal values, unfortunately, do not exclude DCM, and 24-hour ECG and echocardiography remains the gold standard for screening of occult disease. Ultrasensitive troponin I values might add some value of that test, but again, I would not recommend to replace any of the other tests, but use it as an additional test. In real life, for example, if we have elevated troponin I levels in a Doberman pinscher, what we recommend is to decrease the time of the rechecks. So instead of yearly screening, we recommend that that dog might come back already after 6 months, because we might see very early changes here. What about NT-proBNP? So NT-proBNP is a natriuretic peptide, and it is thought to be increased when we have a disease that has either volume overload or pressure overload. And we evaluated that NT-proBNP in Dobermans with DCM in different stages. And those are the same stages as you saw on the previous slide concerning troponin I. We had dogs in the still normal groups, dogs that only had VPCs, echocardiographic changes, a combination of echocardiographic changes plus VPCs, and dogs in the clinical stage. And all of these stages were actually significantly higher than the control group. The problem with biomarkers is that you have to understand how to use them. So if you want to diagnose, for example, dyspnea, or to differentiate dyspnea in a dog that comes to the clinic, you will have high cutoff values. If you want to use a biomarker for screening purposes, where you want to detect very early disease, your cutoff value will be quite low, because otherwise you will not detect early changes. So therefore, according to our study, we recommended a cutoff value of 400 to screen for all stages, and had a sensitivity of 81% and a specificity of 75%, which is okay, but it is not great. However, where NT-proBNP is quite good for is to predict echocardiographic changes. So if you use a value around 500, the specificity is quite high. So if NT-proBNP is higher than that in the Doberman pinschers, you might predict that the dog has echocardiographic changes. We have to note that the values or the cutoff values that we established in that studies used an older version of the NT-proBNP. So using the new version of the test might actually have a slightly different cutoff values. A study that was recently published looked at the predictive value of NT-proBNP and some other markers in Doberman pinschers. And what they found in their study was that if a dog had less than 50 VPCs per 24 hours, they lived much longer than dogs that had more than 50 VPCs. This is not that surprising, because VPCs are signs of the arrhythmogenic stage in Doberman pinschers. What was quite interesting was that the value of NT-proBNP, if it was higher than 900 picomoles per liter, the survival time was much shorter than if it was less than 900, as you can see on this slide.